Hello, I am Dr. Nikhil Datar. I am a practicing gynecologist in Mumbai. In this video, I am going to speak about what tests can be done by pregnant women to find out more about whether the baby in their womb is normal or no. In this context, there are two types of major things that can be screened or tests can be offered to pregnant women. One of them is by doing a detailed sonography. Now, if sonography is done between 18 to 20 weeks of pregnancy, a detailed screening of various structures of the baby and the body parts can be done. So, if there are any structural defects, then they can be picked up during this sonography. However, there are few structural defects which may not get picked up by 20 weeks of pregnancy. Now, I am going to speak to you about finding out more about Down syndrome. Down syndrome is a genetic abnormality which is quite a common abnormality that is found among human beings. A chance of a pregnant woman below the age of 30 to have a Down syndrome could be somewhere around 1 in 900 or so. Whereas a chance of a woman between the age of 30 to 40 could be somewhere around 1 in 100 women. Because it's a common abnormality and because Down syndrome is known to cause a significant amount of mental retardation amongst the children, there are many pregnant women who would want to confirm or cross check whether the baby in the womb is suffering from Down syndrome or no. To find this out, there are two types of tests which are available. The first type of a test is called as a diagnostic test, which means by doing this test, you will get a 100% sure shot answer whether the baby in the womb has got a Down syndrome or similar chromosomal abnormalities or no. However, for doing this confirmatory or a diagnostic test, one needs to undergo an invasive procedure whereby the fluid around the baby has to be sent for examination. Naturally, every woman would not want to do this, and every doctor would also not want to prescribe this. So then the question comes up is to whether there is any non-invasive test available to find out about the same. Well, these are those kinds of tests which are called as screening tests. Now, screening tests are those tests whereby a sonography or a blood test is done on the mother, but we are trying to find out more about the baby. Naturally, these screening tests can only tell you whether you have a low chance of having a Down syndrome or you have a high chance of having a Down syndrome baby. Typically, if these screening tests show that you have a high chance of having a Down syndrome baby, then a confirmatory or a diagnostic or an invasive test can be offered to you because you are from the high chance zone. If you are in a low risk zone or low chance zone, then generally confirmatory test is not expected to be offered. In these screening tests, the most important screening test that you should know about is called as a dual marker test. Now, this is a test which is done at about 12 or 13 weeks of pregnancy. This is a blood test which is to be done. Along with the blood test, there is a sonography which is done, and there are few important details that are captured from the sonography. Combination of the sonography as well as blood tests can give you a significantly good and an accurate prediction whether you are into a low risk category or a high risk category. There are two other tests, one called triple marker test and a quadruple marker test, which are generally done after about 15 weeks of pregnancy. Triple marker test is not supposed to be so accurate. As compared to that, a quadruple marker test is little more accurate than a triple marker test. There is a new test called as NIPT, which is again a blood test which is done from the mother's blood. Now, in this case, from the mother's blood, one is trying to find out presence of DNA of the baby, and this particular DNA can be checked for presence of chromosomal abnormality, particularly like Down syndrome. Obviously, this test is quite costly. So, considering the cost, the benefit, the predictive value of the test, the dual marker test, that's the test which is done at about 12 or 13 weeks, which is a blood test plus a sonography, turns out to be a decently good option to find out more details about the baby. Mind you, Down syndrome is a problem which has no treatment as such. The only alternative that the woman has, if she has a Down syndrome baby, is to consider termination of pregnancy. In this particular country, termination of pregnancy as it stands today is not allowed beyond 20 weeks, especially if there are substantial abnormalities in the baby. So it is important that conclusion is made before the 20 weeks cutoff is reached. But there may be some woman who may not want to terminate the pregnancy, nor would she want to know more about the baby itself. In such situations, it is always better that the woman does not opt out for any kind of a screening test and just continues the pregnancy. If at all a screening test is done, and if at all you are found to be in a high risk category, then it is always better to reconfirm by doing a diagnostic test, and all this has to be done before the 20 weeks limit.